Hello and welcome. This is Anahita Vora from Kivi News. Today we are particularly talking about the outbreak of Nipah virus, which has been taking over many lives in Kerala and now slowly spreading all over. "16 lives in Kozhikode and Malappuram districts have been lost since the first Nipah virus case was reported. The doctors, nurses and patients who were found infected were told to take leave so that the virus doesn't spread more. Moreover, the Public Services Commission PSC exams have been postponed until later. Reopening of schools and colleges in Kozhikode and Malappuram has been deferred to June 12th as a precautionary measure. Minister K.K. Shelja told reporters the cause of death of a woman who was under observation for Nipah symptoms is yet to be ascertained. The Directorate of Health Services official said the woman accompanied a patient to the Kozhikode Medical College hospital where a Nipah-affected person was being treated. The Chief Minister of the state also directed the Kozhikode and Malappuram district collectors to deliver free kits of rice and other essential food articles to the homes of those under observation and to those in need of them. In fact, the scare is such that the Kutyadi MLA Parakal Abdullah walked into the assembly wearing mask and gloves and was seen greeting the opposition members the same way. Now, let's talk in brief what exactly is Nipah virus. According to WHO, World Health Organization, Nipah virus infection is newly emerging that causes severe disease in both animals and humans. Talking further, let's discuss how did it come into existence. NIV was first identified during an outbreak of disease that took place in Kampung Sungai Nipah, Malaysia in 1998. On this occasion, pigs were the intermediate hosts. There is no vaccine of either humans or animals. The primary treatment of human cases is intensive supportive case. Experts say that Nipah virus is an airborne transmission infection that can affect those who come in direct contact with contaminated bodies. The symptoms of Nipah virus is usually associated with inflammation of the brain, due to which severe days of fever can often lead to a state of confusion, disorientation and even persistent drowsiness. If not taken care of, these symptoms can even cause a coma in a span of 24 to 48 hours. The early symptoms are not very clear and can easily be confused with that of viral fever and common cold. Some common signs and symptoms of NIV are headache, fever, nausea, dizziness, drowsiness and mental issues such as confusion. These symptoms can last up to 7 to 10 days. Watching out for respiratory illness during the early stages is also a must. Further, talking about the remedies, there is no such vaccine that can heal Nipah virus. However, the Indian Council of Medical Research (ICMR) had earlier reached out to the University of Queensland, Australia, which has developed an antibody to combat and neutralize the virus. The antibody was expected to reach India on Thursday, June 7, 2018. The antibody is still referred by a number and not a name, as its clinical trials are yet to be completed. It is important to note that the antibody can only neutralize the effects of the virus and is not a vaccine. We have also asked them to give their monoclonal antibody for conducting a test in India to find out if it can neutralize the Nipah virus in humans. In Australia, it has only been tried in vitro, happening outside the body in artificial conditions, often in a test tube, and has been found to be effective, but it has not been tested on humans yet. Dr. Balram Bhargava, ICMR Director General, said while clarifying that it will not lead to the creation of a vaccine. Within 12 hours of Nipah virus outbreak, team of doctors reached Kerala, discussed disease management and controlled it in a time-bound manner. Health Ministry and I are personally monitoring the situation. There is no need to panic, said Jagat Prakash Nadda, Union Minister of Health and Family Welfare, Government of India. Recently, a massive door-to-door awareness campaign against the zoonotic epidemic, Nipah virus, led across to the state.